Murphy!
I'd like to introduce you to the future of medical research, digital metabolic twins. My name is Jadzia Murphy. I'm a second-year PhD student in the School of Medicine. Imagine that you could create a digital copy of yourself. You can input personal details, such as your age, sex, weight, your diet, exactly, down to the gram. And then there's the medical details. For example, if your doctor requests a blood test, those exact blood results can be input into the digital model. And then there's bacteria. Some of you might be familiar with the concept of the gut microbiome, which is all the bacteria that live inside your large intestine. Well, those exact bacteria living in your gut can be input into a digital model. And this isn't just a hypothetical scenario. You can, or well, we can, create a digital copy of your body. The human whole body model contains all of the reactions that take place during metabolism, which is the breaking down of food into nutrients. It also contains information such as genetic information and organ-specific reactions. But what do we do with these models? My work focuses on the study of inherited metabolic diseases, or IMDs. IMDs are a genetic defect in a metabolic pathway. And for many of these, treatments are available through dietary intervention or medication. But due to how complex and rare they are, they can take an average of 5 years to accurately diagnose. And time is really of the essence when it comes to these diseases. Delayed diagnosis can lead to a toxic buildup of compounds that cannot be broken down by someone with an IMD. And as it's a genetic disease, it's present from birth. So many patients are babies and young children. And this can cause a lot of stress for families with a sick child looking for answers. I'm a part of an EU-wide project called Recon for IMD, which involves scientists and clinicians from across 14 different European countries. The aim of this project is to accelerate diagnosis and treatment of IMDs. By using digital models, we can identify markers for diagnosis and treatment without having to involve a real patient over and over again for further testing. And importantly, these rare genetic diseases with a small sample size can be studied much easier by using a digital model. I hope that through my PhD research, I can make a real difference to the diagnosis and treatment of IMDs in Ireland and across Europe. Thank you very much for listening.